I'm Rachael Thompson. I'm the Advocacy and NDIS Appeals Manager at the Rights Information Advocacy Centre. So we're a disability advocacy organisation that covers regional Victoria and supports people who identify as having a disability or mental health condition and is wanting support to navigate issues that they might be having with their rights. Ideally, in relation to the NDIS, an advocate's role is to support people to navigate the processes when they're having an issue with their rights. So this might include if they're not happy with the way they're being treated and they're wanting support or guidance to make a complaint. They might be wanting support or guidance to go through a process of review. So this is an internal review or an external review if someone's not happy with the decision the NDIS has made. And also if people are having issues with a service provider and they're wanting to make a complaint to the NDIS Quality and Safeguards Commission, they might seek some help from an advocate. So one of the areas that we feel is putting pressure on advocacy in relation to the NDIS is the NDIS access process. We're finding that people are getting confused and lost with the guidance and with the process and the evidence that they need to get. So people are coming to advocacy because they need more support. It would be much better if, as the NDIS promised, that it would be providing the support to people to be able to navigate the processes to get onto the scheme itself. So another area that's putting pressure on advocacy organisations is the complexity of the plan review process. People find this process really intimidating, and if they don't have the supports around them to assist them to navigate this process, they're coming to advocacy just in case something goes wrong. So this puts us in a difficult situation as advocates because we're having to make tough decisions about whether we can support someone or not because it's not something that an advocate is funded to do. I had a referral once for someone who was stuck in a nursing home and they had an NDIS plan. They didn't have any support coordination funded in their plan and they hadn't been contacted by their local area coordinator. So they'd been given an NDIS plan. They had no idea what it meant or what they needed to do with it. So their first step was to contact an advocate. Our role in this, of course, is to make sure that the local area coordinator is doing their role to support that person to understand their plan and help them to navigate the supports in their plan. This just puts extra pressure on advocacy organisations when it's something that should be done in the first place. As an advocacy organisation, we feel enormous pressure with the additional referrals that the NDIS has brought. People are often coming to us in crisis and we're having to make difficult decisions about who's in more of a crisis and who needs more support. We're often having to close our waitlists even because of the demand is far outside of what we can provide. Most advocacy organisations are funded quite minimally and are operating with low staff numbers. And so we're doing everything we can, and because we are wanting to see people be supported, there's a real risk that advocates can burn out in this sector. So anything that can be done to improve the administration and the systems working together so the gaps are addressed is going to be so valuable for the future of advocacy.